digital synovial sheaths and fibrous flexor sheaths of hand, and also scaphoid fracture and avascular necrosis. The competencies covered are scaphoid fracture and explanation of anatomical basis of avascular necrosis, and fibrous flexor sheaths, ulnar bursa, radial bursa, and digital synovial sheaths. Scaphoid fracture and explanation for the anatomical basis of avascular necrosis. Scaphoid fracture, it occurs due to fall with an outstretched hand with wrist in hyperextension. The middle of scaphoid or waist of scaphoid is the common site of fracture. It presents as a painful swelling of the wrist or at the base of the thumb. Tenderness is also felt over the anatomical box. Anatomical basis for avascular necrosis is the site itself, the site of fracture, the waist or the middle of scaphoid. Blood supply for scaphoid is from distal to proximal. It is the only source of blood supply to scaphoid. Avascular necrosis is cell death due to cut-off of blood supply. Then we go to fibrous flexor sheaths, ulnar bursa, radial bursa, and digital synovial sheaths. Digital synovial sheaths. These are serous sacs of hand. They are there for the lubrication of the tendons. The long flexors are surrounded by these sheaths. Long flexors are flexor digitorum superficialis, flexor digitorum profundus, and flexor pollicis longus. Digital synovial sheaths. Digital synovial sheaths begin 2 to 3 centimeters proximal to the flexor retinaculum, and they end at different places. Depending upon the termination, they are named as ulnar bursa, radial bursa, and digital synovial sheaths. Radial bursa. It is a synovial sheath on the lateral side, and it provides sheath for flexor pollicis longus tendon. It extends from, that is, 2 to 3 centimeters proximal to flexor retinaculum to the base of distal phalanx of the thumb, which is being the insertion of the tendon. Ulnar bursa. It is a common synovial sheath for 8 tendons, that is 4 belonging to flexor digitorum superficialis and 4 belonging to flexor digitorum profundus. This also extends, that is 2 to 3 centimeters proximal to flexor retinaculum to the base of distal phalanx of little finger only. For other fingers, it ends at proximal crease. Ulnar bursa. For some distance, the tendons are without synovial sheath. At this place, where the gap is there, the tendons of flexor digitorum profundus will give rise to lumbrical muscles, which subsequently enter the digital synovial sheaths of the medial 4 fingers. Digital synovial sheaths. These are present only in the middle 3 fingers. They contain the tendons of index, middle, and ring fingers. They begin at the distal palmar crease and end at the base of distal phalanx. Fibrous flexor sheaths. They are made up of deep fascia. They are present in the anterior surface of phalanges and are attached to the sides. They extend from the heads of respective metacarpal to the base of distal phalanx. Proximally they are open Distally they are closed. Together with phalanges and interphalangeal joints, they form blind tunnels. These sheaths are lax near the interphalangeal joint, but strong at other places. In these tunnels lie tendons of long flexors. They keep the tendons in position and prevent them from springing away during the flexion of fingers. Thank you.